So I'm going to talk about mental illness before and after the biopsychosocial model. So imagine that it's 1932 and you or someone you love has just been diagnosed with a behavioral disorder. Now, in this time, the medical model that was in place was the biomedical model, which prevented doctors from diagnosing you and considering any sociological or psychological aspects. Therefore, if they couldn't find anything physically wrong with you, then they kind of deemed you crazy. So what they suggested at this time was that you just be put into a mental institution, put out of the way of society, and not really thought about ever again. So your family wouldn't really go to visit you because the stigma around mental illness in the early 1900s was huge. People didn't really understand it because doctors weren't diagnosing it properly. And so everyone that was diagnosed was just sort of pushed out of the way into mental institutions. So in these institutions, doctors had to do something to cope with the amount of patients that they had in there. So they tried a lot of radical therapies. One of the therapies that was really popular and very experimental was the frontal lobotomy. So they would separate the front part of the brain from the back part of the brain, hoping that to calm your personality. It was mainly for personality disorders. And so in some cases this worked. In some cases people became more mild, more calm. In a lot of cases though, people would die. People would just become kind of shells of who they once were. They had no personality whatsoever. And so it was really risky therapy. Electroshock was also another popular therapy. Doctors would just shock the patient's brain, hoping to kind of restart their neurological processes. Again, it was really dangerous, very painful and traumatic for the patient, and not deemed truly successful. And so because of these therapies, the stigma around mental illness continued to grow. They saw people with mental illness kind of as monsters, crazy, not something that they wanted to deal with at all. So in 1955, medication began to be developed to help with psychosis. So chemists started experimenting with different drugs, hoping to find a better alternative to just these experimental radical therapies. And in some cases, they worked. In some cases, they would mild the personalities and they wouldn't have any side effects and it would be successful and the patients could leave the institutions. But in a lot of cases, they didn't work. So it was just kind of a small patch for a much larger issue. Not everyone could respond to these drugs and they had a long way to go before they had any real effect. But at this time, mental illness, the stigma started to be reduced just a little bit. So a lot of patients could go out into society, and therefore society was seeing them and living with them, realizing they weren't these crazy people after all. So in 1955, after the first antipsychotic drug was developed, the deinstitutionalization movement began. Society finally realized how awful these institutions were and how much like prisons they were, and so they started closing them down, and these huge influxes of patients came out of the institutions and into society. And they were integrated somewhat, but there wasn't a lot of room in like halfway houses and communities for the patients to go. So a lot of the homeless population ended up being made up of mental patients at that time, and a lot of them were incarcerated just because they didn't know what else to do with them. So the stigma continued to decrease just a little bit, but they still didn't know completely how to live with these people. So in 1977, George Engel officially introduced the biopsychosocial model to society. So this model allowed or forced doctors to diagnose patients with psychology and sociology in mind, along with the physical issues of the body. So at this time, mental illness was diagnosed a lot more commonly, and a lot of people started knowing people with mental health issues or something like that. It wasn't this uncommon thing like it was before. And so the result of this new model was that institutions weren't seen as these places where crazy people went. There were places people could go and come back better people with better mental health. And on the MCATs, doctors now are tested on sociology just as much as they are on biology or any other physical science, which means that they're forced to consider those factors when diagnosing patients. And we also have mental health awareness, which is something in the 1900s we just hid them away and didn't think about them, but now we can celebrate them and bring awareness to them, which is something we could never do before. So it took a lot of decades and the whole shift from one medical model to another, but throughout time, we finally decreased the stigma around mental illness, and the effects today could not be more beneficial.